case number 4, T3 and T4 as well as the TSH, all the three values are on the lower side. So what is, we said that probably it can be hypopituitary hypothyroidism, but as sir has mentioned, till we confirm it, we cannot label it as central, because even a sick euthyroid may have sometimes similar findings. So we suggested the patient to get a free T3, free T4 and cortisol done. The cortisol value was also less than 1, so it was on a lower side. So probably this patient is hypopituitary or central hypothyroidism.
This patient could also actually have nephrotic syndrome, for all you know, because if the proteinuria is say like 7 grams, 8 grams, you will find this typical report even in a normal person with nephrotic syndrome. So this test would have different interpretations, starting from just nephrotic.
It is said that even diseases like anorexia nervosa or a critically ill patient, a chronic critically ill patient 100%. May have similar findings. Yes.
100%. Yeah. That's why I said the clinician in such cases, it's absolutely mandatory to talk to the clinician. I mean, both should talk to each other, because given a value, you can't say what this is. It could be anything amongst all. I mean, central hypothyroidism, sick euthyroid syndrome, patient of thyrotoxicosis on treatment. It could be nephrotic, it could be critical care patient, it could be anything.
Case number 5, again we have low T3, low T4 and a TSH. So probably the differentials are very similar to what we've already discussed, but the only point here is the TSH there was clear cut on a lower side. In this case the TSH is in the normal range. So any other suggestion? So again with a similar background, we got a free T3, free 4 done. In the free T3 value tallied with the T3, again it was on a lower side, but the FT4 value was in the normal range. So then still sort of we have a query, sir, if you can just tell us whether it is a pre-analytical thing that the sample took a long time till it reached our lab, and it is the cold chain problem.
I mean, you make a very valid point here that if samples are not transported correctly, then you can certainly have problems, particularly in the T3 and FT3 analysis, particularly T3. But there is another thing that I would also like to point out here, is that normally we make the point that in central hypothyroidism, your T3, FT3 and T4, FT4 will be low and TSH will not be elevated. That is the clear idea, okay?
Right.
But it is known that even with central hypothyroidism, you can have TSH elevations going up to 7 or 8. Now there it is a big trouble, because you can't really interpret what it is. Again, as I said, you will have to discuss this. Two people will have to discuss this together. But what I'm saying is that normally we say that TSH must be normal or low in central, but it can go high up to about 7 or 8 sometimes. Reasons unknown. But this cold chain point is absolutely valid, and it is important for thyroid, and it is important for even other hormones. I'm sure you will take them up later, but certainly important.
Sir, the explanation for TSH to be within the normal range or slightly above normal in a person who is having, say, central hypothyroidism could be that this TSH which is produced by the pituitary is reactive in the immunoassays which we employ in the laboratory, but it is not active clinically. It is not active on the receptors. That is why it does not produce the symptoms.
Agreed, but that's not the real reason why the TSH is actually going high, because there is no reason why the pituitary should produce what are called bioinactive TSH. Nobody knows really why in some patients the TSH is borderline high. Some people say that the pituitary is slightly responsive or something like that, but we don't know. I'm not going to go into that. I'm just pointing out that it can sometimes go high. The point that I'm trying to make is that based on a T3, T4, TSH alone, it is, unless it's a very, very clear-cut thing, to make a comment that this is central hypothyroidism, this is primary hyperthyroidism, this is primary hypo, is very difficult unless we know clinical history. And that is the point I'm trying to make.
See, this particular case I want to bring to you because I want to tell you the importance of cold chain. See, outside the body, TSH remains stable for quite some time at room temperature, but T3 starts falling very rapidly, and then comes the T4. So maybe even free T4 will further fall down. So whenever we get such a report, what happens is, if on face value someone says that this report is wrong, that's why you have to be sure, you have to mention such things like cold chain problem and ask the patient to repeat the test on fresh sample or follow the cold chain. Otherwise what happens is, patient comes with 3 different reports from 3 different labs, and he in fact troubles you a lot. And he takes your almost half day by saying that you are wrong. From this lab he will go to the next lab, he will trouble them. And nowadays it is very common that they go to consumer court and easily put the case. That these all the lab which he likes, he will say it's the correct lab for him, and the rest 2 or 3 are wrong. But the whole problem is, it may stand, it may not stand in the court of law, because the judges are different. They consist of 3 judges. One is the jury, which is their community's person, social worker. One is the jury, which is totally social worker, and the third one is the judge, and there is no technical person involved. Unless I raise this point and I call Dr. Fadke as a jury, your case will not stand, you will be troubled over years, and you will have to spend money on your advocate. So he has just put one single case on you because he has 3 different reports in hand. So you have to be very careful while releasing the report.
Out of context to all this, but I'll tell you a very interesting story which brings out this fact what sir said. Actually, the BioMeriu company had sold a couple of machines in Uttar Pradesh, and in one lab, that lab actually sued the company saying that your machine is faulty and we are getting wrong results all the time. Now, several times, though, the engineers from that company took that machine, tested it in their laboratory for all QC parameters, and all the time everything was running well. And again, when the machine went back to the lab, they used to have the same problem. They were typically facing problem of low T3, T4. Now, those guys actually contacted me for, just out of frustration they talked to us once. And the funniest part was, then the whole thing started getting investigated very systematically. Now, this lab used to collect samples from a lot of people in Uttar Pradesh, in a smallish town, and by the end of the day, they would separate the sera, store all the alicos, and by the end of the day, they would put up those tubes for testing. Now, what we found was that because the serum was standing there like that for the whole day, there was a protein layer forming on the top, and the dipper used to touch the protein, dip it, and come out, because it sensed that it has dipped. These are all sensed machines, so it will only reflect whether it has gone to a certain depth to pick up the sample. It would not pick up the sample because the protein layer would just dip and come out. And the only thing that they had to do was to stir the sample before they put it in the assay, and they started getting normal results. So what I'm saying is, it's very easy to just say that, oh, this is all rubbish, but there are so many things. So the cold chain is one. Just storing samples outside in the room temperature can cause coagulation of proteins and a lot of changes in.
Even if you recentrifuge the sample, you realize the values have changed. So centrifugation is important for separating serum or plasma.